I feel like doing the job well means the same across the board on the, on the very basic level, kind of how we've been discussing. But there's absolutely, a special level to that. So
When we're talking about ethics, you can't really talk in terms of black and white. There's two terms that are used in ethics. One is called deontology, and the other is called teleology. So deontology is following the rules, which we do have to do. We have a code of ethics that we have to follow. So following those rules would be considered deontological. So there are times where some of our rules that we have to follow conflict with some of the values that we have in ethical decision making that we do. So when there's that conflict there, and it doesn't have to be rule based versus value based. It can be two values that just conflict, like autonomy and impartiality. So we want to make sure that we are impartial and that we don't interject our own opinions and that we remain neutral. That's very much a value of interpreters. But we also value the patient's autonomy to make their own decisions. And so typically, in order to give the patient the most autonomy possible, we need to be as impartial and unobtrusive as possible. But there are some times where, as an interpreter, I recognize that the patient's nodding their head like they understand, but they really don't. And we know they don't. We can see it on their face, or we can just tell they just don't. And so I'm going to have to forfeit the being unobtrusive, for example, because I'm going to need to interject somehow in order to enable the patient to continue to stay autonomous in their decision making. So I may have to, advocate in some way, or I might have to, I don't know, I might have like one tool I use sometimes is saying, even though maybe I understood that medical term that was just used, I may say, doctor, would you mind explaining that just a little bit differently? I think we have to make sure that we're effective in the way we do our work. And so, and how do we measure effectiveness? And really was the goal of that particular situation able to be accomplished? The doctor wanted to communicate something to the patient and wants the patient to understand and be able to provide informed consent or agree to the treatment plan. Were we able to enable that to happen?
yes, and it would look different in different situations. Absolutely.
Mm-hmm.
We can't look at one thing and say this is exactly how it's supposed to look like every single time. There is the piece of that critical thinking. I do think if we understand the question more from the concept of where, like, my personal belief as an interpreter collide with, maybe what's being discussed, um, in the encounter, I do think part of, like, I have to be careful to not allow my personal belief to influence the conversation. So in that regard, I do think part of doing the job well is not introducing my bias into that conversation, um, because I do think that the interpreter should not, like, dilute meaning or direct outcomes. Like, sometimes we can be so afraid to um, say something. We don't want to assume that another party will feel a certain way. So I think there is part of the integrity to what the interpreter does and says, to make sure that the encounters protected, that it's true to the meaning of the person communicating the information. So in that specific area, like I would define doing the job well as, being able to sit in my discomfort, um, with this specific scenario, um, but being very diligent to not allow that to come across in my word choice,
Mhm.
in my intonation, back to the
Mhm.
poker face in my facial expressions,
Mhm.
um, whether we are on video and in person. Um, even for OPI interpreters, I often say, I can tell if you're smiling or if you're grumpy on a call sometimes, even without any visual clue, because there is certain way our voice carry, um,
Mhm.
and it shows. You can tell the disapproval in a tone of voice, and you may say every meaning for meaning correct words, but I do think as interpreters, we need to sit with that discomfort, um,
Mhm.
of where our personal beliefs land, know what we can and cannot handle. And if we find ourselves in situations where they get challenged, we need to be very careful, to make sure that um, we're being um, faithful to ourselves, but at the same time, protect the integrity of the encounter that's going on and the information that's being shared.